One of the 4 types of neck pain is neck pain with radiating pain, pain shooting down the arm into the forearm or hand. It is sometimes also coupled with tingling and numbness or weakness sensation. Such pain is often associated with nerve impingement, frequently from herniated discs, but not only. And that's what this video is about. I'd like to show you how muscles can masquerade all the symptoms of compression of the nerve that's typically associated with disc problems. Most importantly, I'd like to show you how to deal with the problem, how through movement control you can say goodbye to the pain. So here we see the front of the neck with the first rib and then second rib. And here we have the gorgeous scalene muscle, the one in front, anterior scalene. It's connecting first rib and the 3rd to 6th vertebra of your neck. It runs from side of the neck to the first rib. Then, a little behind it, we have the medial scalene muscle that also attaches to the first rib and connects 6 vertebrae of your neck. Between these 2 muscles, there is brachial plexus that supplies nerves to your shoulder, to your arm. And you can imagine how spasm or excessive improper contraction of these muscles can impinge brachial plexus, giving origin of pain, numbness, and weakness. What we want is spaciousness in that area. So here we have our first rib right above the collarbone. And we'll go about improvement through enhanced control, or in how many more ways can you use the muscle beyond your habit, as habits often are the culprit of overuse. So the first of the choices is to raise the rib cage, raise the shoulder and the first rib. The second choice is to bring the side of the neck toward the first rib, tilting the head and neck slightly to the right. The third choice is to bring them together. We elevate the ribs and tilt the head sideways. The fourth choice, we can tilt the head to the side and move the first, second rib down away and up toward. We're taking the starting position in a different place. Now you can keep the shoulder up and the rib up and tilt the head away from the raised rib and toward the raised rib. These are the basic choices. As you master them, after a few weeks, you can try to do 2 movements at the different speeds, very slowly raising and lowering the first rib and your clavicle and your shoulder, and at the same time introducing a little bit faster, but not rushed, movement of the neck from side to side. Remember, the movement should not produce any pain. It should be completely free of pain. And the head is making several movements from right to left during one shrug or lowering of the first rib. The size of the movement can be small. Remember, the differences that we're after are in your brain, not achieved by stretching or efforting. Don't worry if it's difficult. You may find that it's quite hard to coordinate the 2 movements independently. That's the whole point. Movement control. Then try the opposite. Slow movement of the head and faster movements of your rib. Lifting, lowering, lifting, lowering, lifting, lowering. It's not going to be easy, but increasing the number of choices over the movement will stop the tension and spasm that's usually associated with one way of moving.